22 minutes to 10 o'clock this morning, Wednesday, the 8th of February. As I was saying earlier, I went shopping for glasses yesterday, and it got me thinking about how important our face is and how that really affects our identity, how we're feeling psychologically, emotionally, our confidence. And so we got in touch with Dr Zainab Al-Mukhtar at Harrow on the Hill Dental and Implant Practice and Health and Beauty Spa. And I'm very happy to say good morning to Dr Zainab now.
Good morning, Daniel. Thank you for having me.
You're welcome. Thank you very much for coming on and having a chat with us this morning. You do so many different treatments at the Harrow on the Hill Dental and Implant Practice Health and Beauty Spa as well. So let's start with the teeth, because this is something which was the first thing I thought of in terms of, for me, the most important part of my face. I spent years with braces on, sorting out my teeth, getting them straight, making sure that I'm brushing them properly. They have a huge role in terms of our psychological sense of self, don't they?
They really, really do. Having healthy teeth that are free from disease gives a person that sense of wholeness and completeness and just this general sense of well-being. And we really can't underestimate that. And then don't forget that being happy with your teeth or having a nice smile is going to just encourage you to smile more. And scientific evidence shows that smiling actually makes you happier. So there's actually this physiological bodily response where you feel an emotional boost just when you smile, even if you just smile in the mirror. So there's definitely that wonderful domino effect caused by smiling, both on yourself and also on the person being smiled at. So it's amazing. And having a nice smile can make a huge difference to a person's confidence. You know the saying that goes, when you smile, the world smiles back. And
yeah.
It's true. It's really true. I've seen the difference that a nice smile can make to a patient's life, whether it's been just enhanced social or personal relationships, or even as far as a job promotion. And that comes from somebody having an increased sense of well-being and confidence to smile and laugh and just to appear to be the best version of themselves without hiding away behind a closed mouth.
That's the thing. I think as you say, it's not about changing your personality. It's about allowing you to express your real personality without any fear or lack of confidence.
Exactly. It's a bit like the saying, the window is the eyes are a window to the soul. But I think actually the smile can be a window to the soul in that way. Yeah, absolutely.
And some people, if say someone isn't happy with their teeth, doesn't smile very much, people can misunderstand that, and people do. It's not deliberate, but people do. They misinterpret it, and instead of thinking that person's not happy with their teeth, they think, what a surly person. That person's miserable. I'm not sure I want to spend so much time with that person.
Exactly. It really does portray a lot, whether we smile or not, and that's key, and that just goes to show. I mean, when we do a smile enhancement, we see the difference, not just in the person's smile when they come back for a review, for instance, but we can see the entire demeanor is happier. They're standing tall, they've got like a better posture, they've almost got like a bounce in their step, and that says a lot to me about the overall impact that the new smile has had on their well-being.
So can you tell me a bit about what is a smile enhancement? How does that work?
So a smile enhancement can be just anything that we have done in order to improve the smile, whether it's aligning their teeth or whitening the teeth or repairing fractured teeth, or just making things look more in harmony and creating something that's more pleasing so that the patient themselves feel comfortable enough to smile. And that is a smile enhancement. I mean, there's such a wide range of treatments that we can provide to produce that. But in a nutshell, most people will kind of require the usual teeth whitening and teeth alignment and maybe veneers just to get that full, pleasing smile.
Something that I think it's one of the sort of slightly ironic but also twisted parts of this is that some of the people who would benefit so much from your services and gaining the confidence and the emotional benefits of that enhanced smile are the ones who are also so scared of their teeth. Is there anything that, say someone is very nervous about things to do with their teeth, very nervous about their mouth, is there anything that they can do, perhaps starting at home, that would help them build the confidence to then come in and chat with someone about perhaps what the next step might be?
I mean, you're absolutely right. A lot of patients coming in for dental treatment have this anxiety because having dental treatment can be perceived as quite invasive, and whether it's a fear that's developed because of a bad childhood experience or for whatever reason, anxiety seems to be something that a lot of patients suffer from. So what they can do is, first of all, just look after your teeth at home. So there's plenty of things that we can do. And once we do that, you're kind of just getting that little bit of motivation. Once you kind of take the first step of looking after your teeth, you might want to then do something more. And at that stage, come and have a chat to a dentist. And I think the key thing is to not feel pressured into having any treatment. If you emphasize that you just want to have an initial chat to discuss your concerns, there's nothing there to fear. So that would be good. But there is plenty you can do at home. Did you want to know a bit more about that?
Yeah, let's find out about that.
So the key things, and this is really important, so I'll run through them because prevention is really better than cure. The first thing is to brush your teeth first thing in the morning, ideally with an electric toothbrush, because evidence shows that electric toothbrushes are more effective at cleaning teeth than manual ones. And the morning brushing should be done before breakfast, not after. And I say this because a lot of people will brush their teeth after breakfast, but that's actually not correct. We want to remove all the bacteria that's accumulated in the mouth overnight before introducing the food, because bacteria will quickly break down that food and produce acid, and acid is what's responsible for eroding the tooth enamel. And then that's what leads to a cavity. So brushing before breakfast, and then the same thing should be done last thing at night, again with an electric toothbrush, ideally. If somebody really didn't want to get an electric toothbrush and wanted to use a manual one, that's okay. But small circular round motions are advised, so definitely no kind of horizontal scrubbing that can wear away the tooth enamel. And always use a fluoride toothpaste. Don't swallow the toothpaste. And spit out, but don't rinse out. I find that, again, lots of people will rinse their water rinse their mouth with water after brushing, and it's a bit of a myth that that's the right thing to do. But actually, that's not correct.
Okay, so you shouldn't. At the end of brushing, you should still have that minty taste in your mouth.
Exactly. We don't want to wash away absolutely all the toothpaste. We want to allow a little bit of the benefit from the fluoride to remain on the teeth. Mm-hmm. Yes. And then flossing. I'm sure everybody's been told by the dentist, floss once a day at least, because no toothbrush will ever get right between the teeth where bacteria and food will often remain. And then there are other adjuncts to these kind of interdental cleaning. Like you can get these interdental brushes that just go between the teeth to clean gums a bit better. And they're probably, more for the people who have gum disease. I think putting too many steps in can put people off. So it's best to kind of cater your oral hygiene routine according to your individual needs, and a dentist would be best to advise that. But generally for everybody, brushing, flossing, and fluoride. And fluoride mouthwash is another thing that can be added.
Yeah, I was going to ask you about mouthwash because I know some people who are on the lazier end of existence, and they'll just swish around a bit of mouthwash and that'll be it, which I would imagine isn't what you'd recommend. But mouthwash with a toothbrush, is that also a good combination?
So mouthwash definitely should not replace brushing, because the mouthwash can't penetrate all the layers of bacteria that we're trying to get rid of with the brushing. So brushing is key, but then mouthwash can be added. I would say definitely do not use mouthwash straight after brushing. If you want to use it later in the day, because if you use it straight after brushing, you're going to again wash away the excellent benefit from the toothpaste, and we want that to remain. So mouthwash at another point in the day is absolutely fine.
And so we've spoken a lot about teeth, and some people listening might have beautiful teeth already, but there are other parts of our face which you also help enhance as well. There's so much attention on our faces. Do you want to talk us very quickly through what else people can come and chat to you about?
Yeah, so we do a lot of cosmetic dentistry, but as an adjunct to that, we do a lot of facial rejuvenation. And what that is enhancements of different parts of the face, whether it's improving the proportions of the face, or lip enhancements, or anti-wrinkle treatments. And this is something that's become very popular recently, because a lot of people, I think, forget that lips frame the smile. So at times, a lip enhancement can just complement a smile makeover. But other times, we're providing this treatment for someone who's upset about premature aging due to smoking or sun damage, or other times it might be because somebody's self-conscious about something they've lived with for a really long time and now finally want to improve on. And like you said earlier, somebody who just looks a little bit unhappy, maybe because of frown lines or a downward-looking smile due to aging, and they're actually not miserable at all. And it's amazing the difference that can make, just having a bit of treatment to uplift these areas. So we do a lot of that, and it's making a massive difference. And I think really we have to remember that physical appearance is linked with confidence so much, and confidence plays a huge role in a person's willingness to participate in all areas of life, whether it's social and personal relationships or even work. So time and time again, we're experiencing just how wonderful it is when patients come back to see us and are very uplifted, reporting how great they feel just after having these kind of enhancements. They feel great about themselves and life. So it's something that we're doing more of now, and it's a significant part of our practice.
They do say confidence is key, and it clearly is. How can people find out a little bit more? If you know, what you've said has really spoken to them, they're thinking, actually, this is something I've been putting off. This is now the time to reach out and have a chat with someone.
Well, there's a full list of our treatments and a gallery on our website. And the website is www.harrowonthehilldental.co.uk. And we're also on social media, so we're on Instagram, Twitter, and Facebook. So plenty of information there, and our contact number, and a consultation can be easily arranged, and we can chat through things.
Perfect. Thank you very much. That's Dr Zainab Al-Mukhtar from the Harrow on the Hill Dental and Implant Practice and Health and Beauty Spa. Lots to mull over there. And if that is something that you're considering doing or just want a little bit more advice, head to that website and find out a little bit more this morning.